Hello, how are you all today? Um, where I am, the sun is still shining, which is nice. Um, School going back soon. May even have gone back by the time this uploads. Um, Today, I'm going to talk about tongue tie. If you are a breastfeeding mum and you are experiencing pain with breastfeeding, it's very, very likely that somebody has asked you if your baby has a tongue tie. You may be wondering what that is, what does it mean, and I'm here to answer all your questions. First thing I want to say is I'm not a tongue tie provider. I'm trained to assess um, a range of normal within the baby's mouth and to recognise when something isn't um, what we would expect, and whether or not it's likely that the things I'm feeling and looking for point towards a tongue tie or not. So just to make that clear from the start, I'm not a tongue tie provider. So a tongue tie, so essentially everybody, many babies have a piece of skin under their tongue. We call it the lingual frenulum. It's just a stretchy, tiny little thin bit of skin. And sometimes in babies, that little piece of skin is tight or thick. And it means that the tongue can't move in the way that it needs to move. So in breastfeeding, we need the tongue to move in what we call a peristaltic wave. So I can't make my highly skilled lactation consultant. The tongue should move in a certain wave-like motion, and if the baby has a tongue tie, they may not be able to do that. They may also not be able to lift their tongue or get their tongue out. For comfortable breastfeeding, how am I going to do this? We need the baby's tongue to come over the lower lip so that it the so that the nipple is not rubbing on the baby's gum, and also to help the tongue to massage the milk ducts so that more milk can come out. So you all know what I'm talking about. If this isn't happening, we're going to have painful breastfeeding. We may have inefficient milk transfer, which means your baby may not be getting as much milk as they need. Feeding could be just an unpleasant experience for both you and your baby. Baby might be fussy, breastfeeding might be painful, you might see problems with weight gain. You may not really see any problems, and that's also fine, but you might have problems. The problem is, how many times can I say the word problem in 30 seconds? The difficulty is that many signs of tongue tie are also quite simply signs of a shallow latch, because essentially a tongue tie causes a shallow latch most of the time. That's what's going on, not always. So if you're having pain, I need to leave my hair alone, I'm sorry. If you're having pain with breastfeeding, the first thing you should be doing is seeking out somebody well qualified to have a look at the latch, to watch an entire feed from start to finish, to make sure that the baby is transferring milk, to give you some suggestions for improving that pain that you may be feeling, and to make an assessment as to whether or not tongue tie is likely. These people will be somebody like an IBCLC or a midwife with tongue tie practitioner training or a health visitor with similar. Most of your midwives, health visitors, and doctors you would come across, certainly in the UK, probably don't have that training. They may know a little bit. It's unlikely that they've had training. Some of them have. So you make sure that feeding is comfortable, and then make sure that the person telling you whether or not they think your baby has a tongue tie is qualified to do so. So some tongue ties can be really sneaky. Posterior tongue ties go right back here, and you can't always see them. And some of these babies can stick their tongue out, but they may not be able to lift the tongue, or they may not be able to move the tongue from side to side. They may not be able to do all of the things that we need them to be able to do to breastfeed well. And you can't tell that just by kind of, no, he looks fine. What we're doing in an oral assessment is we are looking for lots of different things. We're looking for how symmetrical the face is. We're looking for any tension that we can see. We're looking for any blisters along the lip. We're looking for how far the tongue can come out and how high the tongue can go. We're seeing how it moves from side to side. We're putting our finger in to see how the baby is sucking on a finger, whether there's a lot of suction there or not a lot of suction there when we pull our finger out. There are so many things that we're looking for. So if you think your baby has a tongue tie, please make sure the person checking is qualified to do so. IBCLC, tongue tie practitioner, or tongue tie trained midwives infant feeding coordinators, health visitors, doctors, not just your run-of-the-mill GP or midwife health visitor. But make sure before you jump into tongue tie that you've checked the issue isn't as simple as, let's do some breast shaping, or let's do the Flipple technique, or let's get you leaning back a bit more, because very often some small tweaks to what you're doing will mean that breastfeeding becomes comfortable. And there are some studies that show in about 50% of cases where there is a tongue tie, with good breastfeeding support from somebody well trained, you may not need to have that tongue tie dealt with. So what do I mean by having the tongue tie dealt with? Well, typically it's a pair of scissors and they snip the piece of skin under your baby's tongue. It may be a laser in some cases. In the UK, it's nearly always a pair of scissors, and the evidence is kind of split on this, but most people will say that the scissors are less kind of traumatic and less painful, and it's easier to heal. Other people are like absolutely adamant that the laser is the way forward. Not for me to say, not a tongue tie provider. Most people will use scissors. It's generally considered a quick and safe and effective procedure. However, in some cases, it may lead to bleeding or infection. It may also lead to feeding aversion, where the baby doesn't want anything in their mouth. So there are risks we have to consider. We certainly don't want to be, in an ideal world, sticking our fingers in babies' mouths in the first few days of their life, because they haven't imprinted on the breast yet. They haven't learned that having things in their mouth is a nice thing. If we go rooting around with our gloved fingers and poking their tongue, we're possibly going to teach them that having things in their mouth isn't very nice, and that can lead to babies not wanting to breastfeed, which is what happened with my son. He really did not like having an oral assessment, and breastfeeding was very, very challenging for us, partly as a result of that. So yeah, those are my my tips for tongue tie. First of all, rule out that it's not positioning and attachment, because it usually is. Secondly, if there is a tongue tie, find out if positioning and attachment is enough to warrant it not being snipped. And make sure that the person assessing is properly qualified to do so. If you've followed all of those, then awesome. Generally speaking, having the tongue tie snipped, if it's going to help, sometimes it can help immediately, but it won't always. So don't be disappointed if someone says, yes, we think the tongue tie needs cutting, they cut it and things don't improve right away. Baby has to learn how to suck in a very different way, and that can take them a little while. You may be given some exercises to just help babies suck a bit differently. You may be told to play some mouth games with your baby. You may be told to leave it well alone. It depends on the provider, and again, it's not for me to say which is better or worse, or okay or not okay. But that's not my role. But yeah, I hope that's helpful. So basically, rule out positioning and attachment. See if positioning and attachment makes it better. Check that the person assessing is qualified to do so, and you'll be well away. Thank you for watching. This is a bit longer than normal. Like, subscribe, share with your friends, and I will see you in the next video. Bye, everybody.